case for community health workers and peer specialists. I think you heard firsthand how important peer mentoring was, whether you call it peer mentoring, peer specialists. Uh, um, we're talking about the same thing, but we're also talking about community health workers. So in some states, uh, like in Oregon, our United Spinal Chapter, Oregon has a Medicaid expansion program. So their peer mentors get training as community health workers. They take a 90-hour training, and then they're able to get reimbursed by their state for the valuable work that they do. So I'm going to turn this over to Natasha Taylor. And Natasha is the deputy director of Georgia Watch, and she could tell you about the advocacy they're doing. And welcome, Natasha.
Thank you, Dr. Tepper. Um, and I just also want to echo what's been said so far in the chat and out loud. Uh, just saluting the bravery of those of you that have shared your stories today. It's really impactful to hear the stories, and it's also impactful for you all to be brave enough to share, to really advocate towards, change, policy change, and improving services out here for others that are going through similar situations. So thank you. Um, for those of you that don't know me, I am Natasha Taylor. I'm Deputy Director of Georgia Watch, and we lead the state's Community Health Worker Advocacy Coalition. And for those of you that don't know about community health workers, I'm going to dive into it. And I'm also excited to see Dr. Randy Smith on the call, who will talk more about the Ivy program at Grady. But I'm just going to jump into really echoing what's been said already about the kind of support that's needed for victims of gun violence, not just on the medical side. I know Eddie talked earlier about, the doctors just kind of give you information and then, you know, that's it, it's hands off, but really having that day-to-day support, people that can see all of the challenges that you have from a holistic point of view, and be able to address just those personal things that you might need assistance with. And then it's also important to have someone that is relatable, someone that's been through what you've been through, makes it a little bit easier, to receive. Building that trust is important, and that's really the role that community health workers and peer specialists play in this space and in many other spaces across our state. So, as I just said, community health workers matter because they're trusted advocates. They're peer specialists. I know Eddie and Shine both said that they are, kind of those trained peer specialists, people that can serve as mentors and talk to other victims of gun violence and provide that encouragement and support. So, community health workers and peer specialists often have shared lived experiences. They connect survivors to healthcare and social services and community resources, and they build trust with hard to reach populations. And again, I want to hone in on that social services and community resources support, because it's not just about providing support from a medical aspect, but if there's an issue with housing, we talked about, losing your jobs. Where can I find new resources for income? Where can I find new work that, builds my confidence and makes me, motivated, right? That's where community health workers kind of tap in with that holistic support, addressing physical, emotional, and social recovery. So, again, for the mental and emotional recovery, and I know Dr. Smith will tap in on this as well, but we talked earlier, we heard earlier about PTSD and anxiety and depression that are common amongst gun violence survivors in Georgia and across our country. And particularly in communities with limited access to mental health care, it's really important to have someone there that can connect you to effective resources and trusted resources. Community health workers also, foster resilience through shared experiences and group support. Again, why I continuously shout out the Ivy program for really being a game changer in utilizing community health workers and peer support specialists to reach those that had kind of lost trust in our system. And then family support. We heard from Mom, Terry, on the call, and how caregivers also need resources to reduce burnout, particularly if you're the sole caregiver. Sometimes it's hard. I know Terry said you kind of lost yourself in what you used to do in providing that care. So community health workers also tapped into the family to see what resources the family can use to help keep them energized and motivated, and then provide that respite care when you need time off as well. Community health workers, are used again in many violence prevention programs in Georgia. They engage in community education and outreach to address root causes in high-risk areas. As we know, Atlanta, Macon, Albany, and Savannah are high-risk areas for gun violence. And they strengthen families and neighborhoods through coordinated care and support tailored to Georgia's unique demographic needs. Again, assessing what is happening in Georgia on a holistic level, all the way across the board, where are supports needed for victims of gun violence. And then the long-term benefits, we've seen, again, with the Ivy program, reduced violence and improved outcomes. So gun victims victims of gun violence who would come into Grady, who go through the Ivy program, are often less likely to return to Grady as a victim once again. So again, and I've met some of the community health workers out of Grady, and they're just so motivating, so encouraging, and they really care about their communities. And that's really what is has been so motivating to me, to see how community health workers really care about the people that they're working with, because they have lived it, they've experienced it. Um, with community health worker interventions, communities experienced a 25% reduction in hospital readmissions. And I know the Grady program has a much higher percentage with that. Peer-led programs improved emotional well-being in 40% of participants in a South Georgia violence intervention program. CHWs and peer specialists in Georgia contribute to better outcomes at lower costs, particularly in rural and underserved areas. I want to talk about the financial impact of CHWs and peer specialists. We've seen reduced emergency room visits and hospital readmissions, saving Georgia millions in healthcare costs. CHWs promote preventative care, lowering costs in Medicaid and other public programs. In Georgia, CHWs help survivors access state-specific aid programs like Georgia Housing Vouchers and Workforce Innovation and Opportunity Act services. And they also influence Georgia policies to protect survivors from long-term financial strain, which was talked about again heavily by the survivors here on this call. So I want to give you all kind of a chronology of where we are with community health workers in the state. Since 2017, and I'm not going to read through all of the bullets, but since 2017, we've been advocating for community health workers here in Georgia. Community health workers have been around for centuries in other countries, overseas. Here in our country, community health workers have always kind of been there. They're that person in the community that knows where all the resources are, how to get to resources. They know everybody in the community. They really have like that pulse on the community. But here in Georgia, we really wanted to start uplifting them as a legitimate workforce. This is a group of people that deserve to be compensated for what they're doing in their communities. And so that's where our kind of walk started in 2017, although Morehouse School of Medicine has been training community health workers for 20 plus years. So DPH, the Department of Public Health here in Georgia, started a CHW webpage in 2017 to start sharing information across the state. An advisory board was created, And then a stakeholder consensus report was created to provide a case for a formal definition of community health workers. The CHW Advocacy Coalition, which we lead at Georgia Watch, was started in 2018. And then the advisory committee continued to meet to really formulate what our policy asks were going to be in regards to community health workers. In 2019, the Department of Public Health received a CDC grant with a portion of the funds going to community health worker efforts. And then DPH hired a community health worker coordinator to support those efforts. There was a forum held in June, again, focused on training, piloting care coordination systems to provide training to 13 community health workers in Georgia, with several community health workers being trained as future trainers as well. So a train the trainer model was created in 2019. And then we hit COVID-19. And this is where the importance of community health workers was really uplifted, because we needed a workforce that knew the community, that was on the ground, and could be pushed into action quickly to serve their communities and lessen the risk to community residents. The Community Engagement Alliance to reduce COVID-19 disparities was created, again, out of Morehouse. And then more initiatives were offered to states, and Georgia was in a position to take advantage of these opportunities and engage partners across the state, again, to uplift this workforce. So from 2022 to the present, again, DPH had funding to fund the training of community health workers. 30 community health workers were deployed at 12 health departments, clinics, non-governmental organizations. Between 2021 and February 2024, 40 training classes were offered to community health workers, offering 9 distinct courses: COVID-related training, asthma education, core competency training, employer supervisory training, diabetes, behavioral health, healthy heart ambassador, emergency preparedness, and tobacco cessation education. Some statistics from that outreach: 2,281,221 individuals were reached through mass media campaigns. 318,398 community members were reached through educational messaging. 65,098 community members were referred to health and social services, but the grant ended on August 29th, 2024. So that's really what I want to talk about today. When we talked about the need for people in the community that know what survivors are experiencing, know what the impacts of a spinal cord injury are, and know how to connect people to resources. Funding is most community health workers are only grant funded. So when that funding runs out, you're now talking about people losing access to resources, not having that, trusted person there to support them, to listen to them, to see them, to acknowledge what is needed, and to be consistent. So in 2020, where are we, 25 now? So in 2022, we started holding community health worker awareness days at the Capitol, really to raise awareness around this workforce, to really show the connection between your doctor, your nurse, your physician's assistant, your social worker, and then that gap that happens between the social worker and the patient, where someone, really could benefit from consistent care, and a trusted person to kind of hold their hand through the process. So we started advocating at the Capitol, talking about the value of community health workers, and really educating policymakers on the work that they do, why they need consistent funding, and why we need a state certification to provide that credentialing and credibility to the workforce. So we've been holding those awareness days consecutively. Our next one is on February 11th at the Capitol. And we're really excited to say that this year we are hopeful that community health worker legislation will pass, creating a state recognized certification for community health workers. The Georgia Community Health Worker network has been established. It was launched in 2021. So now we have a network of community health workers that are all talking to one another across the state, sharing resources, job opportunities, and providing, insight onto the work that they do, and then letting us know as advocates what they need to continue their work. Consistently across the board, when I talk to community health workers about the potential of losing their funding and losing their jobs, they say to me that they don't care about losing the money that they're bringing in. They're concerned about the people that they work with and not being able to continue to provide that support. Many community health workers have caseloads of upwards of 100 people, particularly in rural parts of our state. So you're talking about hundreds of people losing that trusted resource in their communities because of a lack of funding. So our legislative efforts, again, are creating that state certification to provide credentialing for community health workers, making that certification optional. So if you've been a community health worker, no, you don't have to go to school to now say that you know how to do your job, but there's a grandfathering process if you want to be certified, but it is going to be an optional certification process. And so this legislation would establish a certification committee at the Department of Public Health to outline what certification will look like in our state. And the reason we did it that way is because we want community health workers to design what they want their certification to look like. It's not our job to tell them what their certification should look like. So on this committee, we will have community health workers, employers, and trainers represented so that all voices are at the table for this committee. Um, so our call to action, joining the advocacy coalition for those that can scan the QR code on the screen, and I'll share the information with Dr. Tepper. But the same way that the stories were shared today, and how you all talked about having that kind of trusted resource, your friends that connected you to resources, people that told you things that maybe the doctors couldn't tell you. It's important to have those people in our lives across the board. So we need your support to come to the table to say why this workforce matters, how this workforce could have made a difference if you had known about it during, your recovery process. So we, encourage everyone to join the advocacy coalition, because in addition to certification, our next steps are going to be working with the Department of Community Health to establish sustainable funding by ensuring that community health workers can be reimbursed via Medicaid. So that is our next step as well. And then I also want to just again share information about Community Health Worker Awareness Day on February 11th. The QR code to register is here, but I'll also share the information in the chat. But again, I'm just always inspired to hear about people going through experiences like the one shared here, people with mental health challenges, people with maternal health challenges, community health workers, seniors who need access to care. Community health workers really are that missing link in care systems, again, for caregivers to really provide those resources, provide that consistent interaction. And really, I think we're at a time, in society where we need consistent people in our lives. We need people that genuinely care, that are consistent, and that can relate to what we're going through. So I'm sure you can hear it in my voice. I'm definitely a huge fan of this workforce. I love the work that they do. I'm always inspired. And I just, again, call all of you to stand behind this workforce and support them in the best way possible. So thank you.
Thank you, Natasha. Can you not close your slides for a minute?
Yeah.
If you go back 2 slides, the one that had, that's one. I couldn't scan it or because of that, right? There you go. If you just leave that up for a second, maybe people could now scan it. There we
Okay.
go.
Thank you.
Thank you. Now you could, close it out and put that information again in the
And I'll
chat.
put it in the chat. Yes. Thank you.
Thank you so much. I think we're really building a case here for the need for reimbursement for these services because, we save so much money. We're providing something of value. And so I'm turning it over to